So thank you for having us today. We're really appreciative that Claire invited us. We are visitors to Gadigal country from the lands on which we are privileged to live and work, and those are the lands of the Jagera and Turrbal people. And we are acutely aware of how deeply entwined creativity and health and wellbeing have been in all First Nations cultures for tens of thousands of years. We pay our respects to all elders, past, present, and those emerging into leadership, and acknowledge any First Nations colleagues who are joining us today, either in the room or online. We're actually going to start with a little bit of an activation. And so Erica Rose is going to lead you through that, and that will give us a kind of a dignified pause while we wait for the slide presentation to start working. So people online, you can join in this too, because I think you can see Erica Rose on camera. So we're going to ask everybody to stand up.
Invite everybody to stand up if you'd like. And I might just grab the microphone. So I've heard a lot of really great words. You're also welcome to sit if you'd prefer, but I've heard a lot of great words today already this morning. Some like listen, inclusive, connection, create, relationship. So we're going to use those to have a little bit of embodied action, because my first arts activity, passion, is dance. So I'm going to invite us all to be moving a bit. So any words that stood out to you today so far? Curiosity, great. Do you have a movement that we could do for curiosity?
Yeah.
Okay, so we have a movement for curiosity, which is sort of like this. All right, can we say it as well? 1, 2, 3. Curiosity. Any other words?
There's a pointer. Oh, there we go.
Reflection. Could we add a different movement for reflection? Could we expand it a little bit? Would that be okay? Okay, so we're going to do curiosity. And then maybe we switch sides and we expand reflection. Of course, you can do your own interpretation of this. Any other words that have connection? What might we do for connection? Great. So our hands reaching side. Connection. Great. And we might just check and see if anyone online has any words that they might have suggested for this. So we can go from the beginning. We have curiosity, reflection, connection. 1, 2, 3. Curiosity, reflection, connection, invitation, and participatory. Great. So what might we do for invitation? Sorry, folks online, we're going to activate this movement-wise. I like this. Invitation. Bringing the arms in. Good. And then last one, participation. Oh, okay. We have participation. We have hands together. All right. So we have to remember them all. All right. We started with curiosity, reflection, connection, invitation, and participation. We have lots of different things for participation. All right, we're going to do it one more time, but can you say it with me as we go? Nice and loud. Folks online, you can say it nice and loud too as well. All right, 1, 2, 3. Curiosity, reflection, connection, invitation, participation. All right, one more time, even a little bit faster. Ready, set, go. Curiosity, reflection, connection, invitation, participation. Great, thank you so much. Are we sorted out now?
We think so.
Oh, thanks everybody for joining.
Cross fingers and toes for us, please. Okay, so at the moment, Erica Rose is going to, somebody's monitoring the chat.
Yeah.
Bonnie's manning the clicker. And I'm manning the microphone. So just to start, we have a lot of slides. We're going to whip through them. We have a few things we want to talk to you about. In the spirit of some of the conversation and discussion that we've already heard this morning, just want to kind of start with a personal reflection. At the moment, the focus of our work and careers is kind of addressing the health system itself and persuading the health system to integrate art and creativity into their planning. So that's the focus of our work. We work for Queensland Health. Erica Rose works for Arts Queensland. But like everyone in this room, we are also consumers of healthcare. And if we are not, then people that we love are. No one gets off the planet without having to intersect with the health system at some stage. And at the moment, we're all here. Bonnie has dubbed us the Busted Husbands Club because we, all three of us, have husbands who are dealing with critical, acute, life-changing illnesses at the moment. So we deeply know, even if we weren't embedded in this work, we deeply know how impactful environment is on the experience that people have within healthcare facilities, whether they are beautiful new state-of-the-art hospitals or small regional clinics or community health centres. We want to make sure that the health system and the decision makers within the health system understand how essential the work is that we all do in this space for the wellbeing and the wellness and the recovery of the people that we care for, and that it is not just a nice to have or a fun add-on. It's actually essential. And it's also extremely smart health economics if you look at the data. So today, what we're going to be talking to you about are the things that we're focusing on. The program that we run at Children's Health Queensland. Children's Health Queensland is the standalone paediatric tertiary and quaternary healthcare delivery service in Queensland. So we look after the sickest kids in the state. They come to us from all around the state and also from Northern New South Wales and from the Northern Territory. We are based at the Queensland Children's Hospital, which opened just over 10 years ago. Erica Rose also works in government. We have formed a partnership to work with Health Infrastructure Queensland, which is our state government department, which manages all infrastructure development in the public health system in Queensland. So we work within that partnership to do the things that will increase awareness of and accessibility to the kinds of programs that we have established at Children's Health Queensland, using that program as a model to seed within all of the health services in Queensland. In Queensland, our health jurisdictions are geographical. We have 16 hospital and health services throughout the state. The exception to that is actually Children's Health Queensland, which is the only statewide service. So we want to kind of elaborate just a little bit on some of the things that we do. Also want to say that our previous careers, we're all out of the arts and into this system. For me, that kind of transition happened about 15 years ago when I moved from a senior position in the arts into health. Bonnie has taken a similar journey from the arts, and of course Erica Rose as well, who began life as a ballerina, her working life as a ballerina, and now with me co-chairs the Arts Health Network Queensland, along with the collaborative partnering work we're doing with state governments. So I'm going to let Bonnie now tell you a little bit about the program that we run at Children's Health Queensland.
Hi, everyone. So really thrilled to talk to you about the Arts and Health program at Children's Health Queensland. We're very proud of it. Initially, obviously, I've come into the role and Lynne has, done an amazing job of establishing these partnerships with our several major cultural, community and academic organisations. So I've been able to come into the program and, kind of build on partnerships that are very mature and established. So as an example, with the Queensland Conservatorium, who've been working with Lynne in this space for a really long time. I've been able to work this year on a very kind of bespoke program for our adolescent mental health facility, Jacaranda Place, with some young musician facilitators from the Conservatorium, working with those young people on song composition and other elements. But so I've been fortunate in that I have come into the role and been able to build on some of the amazing long-standing partnerships that Lynne has established. But then also kind of, added some of my own as well. So I've recently joined the board of the Brisbane Multicultural Arts Centre, and that's given me the opportunity to bring some kind of more diverse and amazing artists to our program as well. So the thing I guess I wanted to say about our program is, it's just really diverse. So we try and make sure that we've got a diversity of art forms. So we certainly, have visual arts, but music, theatre, dance, all the art forms, virtual reality. And then I guess the other thing to say is the diversity of the kind of projects that we work on. So anything from helping one of our teams to have young people illustrate and assist with a strategic plan. So we might use an art making workshop to do that. To having artists in residence working on really specific challenges, like making our LGBTQIA+ staff feel more welcome and safe. So, the diversity of the things that we're doing is so vast. It's just an exciting program to be part of.
So I should have said at the beginning that the title of this session, kind of masterclass, is a bit embarrassing. We don't consider ourselves masters of anything. We know that there are a lot of very experienced people in the room. What we're trying to do today is just show you what we do and tell you how we do it. And then we'd love to hear more from you in terms of how you put your own practices into action. So we're just showing you some slides of some of the work that we've been able to do. Without a doubt, the key to the success of our program is partnership. We started out with no budget and with me 3 days a week. We now have 2 permanent full-time people plus various other people working in the program. But the thing that provides us with the program itself and what we can deliver on a daily basis are the partnerships that we formed with cultural and community and academic organisations. Looks like our PowerPoint has now decided that it doesn't like us anymore.
There we go.
Okay. So at Children's Health Queensland, we have a hospital, which is in the middle of the city and a big, bright, shiny example of the delivery of paediatric care. But we also have over 80 community sites. They can range from shop fronts where you can go and take your baby and have it weighed to residential hubs in community to specific mental health clinics or child development clinics. And our remit is to somehow introduce the benefits of arts and health to all of those spaces, not just the hospital, which is highly visible in the community. And that's where our partnering comes in. We've been very privileged to be able to embed the Arts in Health program into the heart of the institution. We are involved in strategic conversations and strategic planning around how our organisation is going to move forward. And we have executive and chief executive support for the program, which is really another essential factor in terms of of being able to sustain program within a health system where, of course, there's enormous competition for the health dollar. So in some ways, because we work in a paediatric environment, we don't, it's not a hard argument to win. Everybody has children in their lives that they love and that they care for, and can imagine what it would be like if those children had to spend long periods of time in hospital, or if their families were suddenly confronted with the kind of catastrophic challenges that many of the families we look after are. So it's not, we don't have to be that persuasive in getting people to work with us, but we strongly believe that the kind of program that we have been able to design is essential, not just within a paediatric environment, but within any healthcare environment. And that is why we're taking our show on the road, and we are working across the state. And we have developed some systems and frameworks in order to do that. So, yeah, well, no, I think Wide Bay is next. Yep. So Wide Bay Arts and Health pilot, Erica Rose is going to introduce this one.
Go back just for a second. Maybe we can go back to the Arts Queensland side just to. So this is all about sort of strategic partnerships in different ways. And so just to frame the context of how this happened and why Arts Queensland is involved in this kind of partnership connects to some of the work that's been happening around Queensland's Time to Shine and the recent 10-year strategy. And if we're really looking at the different priority areas, that arts and health fits into a number of these different areas. And so in terms of, looking at these Queensland experiences, maximizing opportunities for Aboriginal and Torres Strait Islander artists, the idea of the creative workforce. And so that's some of what we'll really see when we talk about the Wide Bay Arts and Health pilot. So we might go to that next. So if we think about the Wide Bay Arts and Health pilot, I have to give a few shout outs because I actually was not involved in the inception of this project. So my colleagues from Arts Queensland, Fiona Forrest and Julie Beveridge, and the staff and leadership of the Wide Bay Hospital and Health Service, and the sort of the people who've been working on this project, and the wonderful Danny Straneri as well, who have led the initiative within Wide Bay Hospital and Health Service, really want to acknowledge the wonderful work that's been done. And of course, the work of Lynne, Seear and Children's Health in really providing that leadership advice around best practice. So this pilot project was an initiative funded by Arts Queensland, but designed and implemented by Wide Bay Hospital and Health Service with the advice and guidance of Arts and Health best practice through Children's Health Queensland. So it's really about pulling all of those different elements together and looking at in terms of some of the key outcomes that came from this. So there were several sort of streams for this project in terms of a Deck the Wards, which was about bringing joy, hope, and connection during the festive season. And we'll have a little tidbit to share from that in a minute. Arts in Action, which is around staff well-being through creative engagement. Creative Transformation, which is around arts practice and transforming a dementia ward. Creative Connections, which was peer-led, arts-based social prescribing and community mental health care. And arts capacity building, so workforce readiness and capability to assure safety and to meet standards. And so these are sort of the different components of this project that started in 2023. And if we think about what the outcomes for this, we're very excited that in terms of one of the key outcomes that there's now a permanently embedded arts and health position that's been established by the health service. And the wonderful Danny Straneri is in that role to continue to lead arts and health initiatives in the Wide Bay area and as part of this larger strategic growth that's happening around arts and health that Lynne described. Now, Lynne, you were a key part of the Wide Bay pilot, so I might pass to you to add in some of your key thoughts.
Sure. So the Wide Bay pilot was kind of a cunning plan that, as Erica Rose described, was funded by Arts Queensland. It was the first really overt arts in health program that Arts Queensland had funded. Of course, we all know the creative health and wellbeing impact of all arts and creative activity, but this one was framed under an arts in health kind of structure, and Arts in Health and Arts Queensland funded the position at Wide Bay. It took a lot of meetings with the executive of that hospital service, which is a huge catchment in central Queensland. They were very suspicious. Why are these people wanting to give us money for this? Because that's not usually their experience. So what we hoped was that by demonstrating the benefits to the health service and funding that position for a period of around 18 months and delivering some key strategic outcomes and objectives, that they would then not want to let go of all of that goodness. And that's certainly been the case. They have a very big infrastructure project coming up, building a new hospital for Bundaberg, which will also benefit from this pilot program and the establishment of this position. So it was an entirely collaborative co-design project. Danny, who I think is online with us today, did some amazing work surveying staff, surveying community, asking them what they wanted, and on the basis of the responses, giving it to them, involving the local arts sector, providing opportunities. It's been massively successful, and I think that there have been benefits and goodwill built, and now quite a lot of media coverage of some of the events and activities, and so a lasting legacy. And that is our goal. We want to see this happen in every health service in Queensland. Out of those 16 health services that I described, 4 of them have established arts in health programs, and so we've got 12 to go. So we thought we would like to show you just a little 3-minute video that Danny herself produced about, in particular, the Deck the Wards project.
That's just one tiny snapshot of all the great work that was done there. And I think I just want to emphasize that this was a very localized approach, as Lynne described, and that it happened because of this partnership, this coming together of both Arts Queensland, the health service, and the expertise provided through Children's Health Queensland, and those elements working together and really focusing on that key co-design from the start, so that it was really responding to what the community wanted, but also giving that time to go at the pace of what the community needed for starting to take on. And now they are becoming great champions themselves of this kind of work. So I always find it really inspiring when it's not just the artists who are the people speaking about the power of arts and health, but the people who are within the systems who are starting to talk about the value, the benefits of arts and health. Go to the next.
Okay. So our evangelism on this topic led us a couple of years ago to some negotiations with Health Infrastructure Queensland and Arts Queensland around making a consistent approach visible within government to the practice of arts and health. A few years ago, Bonnie and I started doing, through our roles at Children's Health Queensland, some consultancy work with some of the other HHSs throughout the state. We got a bit of media attention for the work that we do, and so we started getting calls asking us for help. How do we do it? How do we get what you've got? And we started out by helping a lot, working with them on ideas and kind of templates and processes and procedures, until it got to a point where it was taking up too much of our time. And we said, sorry, we can't do it anymore. And the response back to us was, what if we paid you? So that was a different kind of question. So we were able to form a consultancy service from within, a paid consultancy service from within our program, which draws in revenue to the program, funds the program, means that we can do lots of exciting things for the program, but at the same time, we can also affect what's happening on a statewide basis, specifically in terms of infrastructure development and the integration of art work into healthcare environments, which is really the first tool in the toolkit, transform the environment, because it has the biggest impact on how you think and feel when you're inpatient or when you're working in that environment. So we started out doing individual consultancy works with different health services. That then led us to this broader conversation with Health Infrastructure Queensland about why isn't everyone doing it? So they engaged us with Arts Queensland to come up with a plan to tackle multiple projects at the same time. So Queensland Health is undertaking a massive infrastructure development program throughout the state. It ranges from building big new regional hospitals to big redevelopments and expansions in the southeast corner, to remote and regional clinic and health centre developments. So we use the model that we have at Children's Health Queensland for project development and infrastructure development, and making sure that arts in health requirements are included from the earliest stages of planning. So not just a budget for artwork, but also thinking about, okay, if we want to have performances, where would we do that? If we want to have artists in residence come along, where would we put them? What would their needs be? If we build a collection, how do we look after it? Where do we store it? And we want to look after it in the way that museums look after their collections, which hasn't been the norm in hospitals in Queensland, but is now the norm at 4 of those health services. So what you're seeing at the moment in the slides are some images of the work that we have done both at our own hospital and in other hospitals. We are now currently working on around 15 major projects statewide. We have been doing that for the last 18 months. We have formed partnerships, strategic partnerships in all of the health services that are involved. And we are leading the curatorial work that is that is integrating artwork and also integrating thinking about arts in health practice into those health services. We are not doing this in a vacuum. There's a lot of work happening in Queensland around the connection between the creative sectors and the wellbeing of communities. One of the projects that we have worked on is the building of a youth hub at Jacobin, which is an outlying suburb of Brisbane. Bonnie led that, so I'll let her tell you about it.
Yeah, thanks everyone. So Jacobin, like Lynne said, is on the north side of Brisbane. There was an alarming rate of youth suicides in Jacobin, and Children's Health Queensland's response was to build a youth hub in partnership with Education Queensland, so in the school grounds of the Jacobin State High School. And I was tasked with the fun part of working with the young people to make sure that the environment represented them through artwork. So did some great creative workshops with the young people. They had very sophisticated ideas. Their priorities were cultural safety, being involved. So they wanted to be part of the art making and part of the sort of curating and selection of artworks. So I had a really great time working with those young people. We decided to do an expression of interest for a First Nations commission. So you can see in the top left, I hope, image is a beautiful First Nations artwork by artist Jennifer Kent. So she integrated some of the ideas that the young people felt were important, but the main task of this particular artwork was to make people feel culturally safe and welcome into the hub. And then the young people created this beautiful mural in the bottom left image, bottom right, sorry, my other left, where they worked with an artist. So we set them up with an artist, and they did several workshops where they came up with a concept, and then they worked with the artist to paint the mural inside the hub as well. And then I worked with them to curate a little collection of artworks that they really led that process. So they felt that it was important to have mostly emerging artists. So artists who are young like them, and lots of amazing Indigenous artists. And they also really wanted local artists. So we did a lot of research and play together to come to, a pretty amazing outcome. And I'm told where they feel, safe and comforted. And the hub is really meant to be a place where they can come and just hang out. They can utilize the laundry or the showers, and they can access some clinical services, but they're entirely optional.
And I think one of the things that we see is we know there's lots of great work happening here in New South Wales around arts and health infrastructure, but as we're going around the state of Queensland, it's also really wonderful to have all these Queensland examples of Queensland artists and the work that's being done, and especially in this space for young people and with young people, and having those voices and those examples of that really participatory way of engaging in the way that Bonnie described. Great. So I think one of the things that we're looking at in terms of the arts and health integration these are a few of the sort of documents that are informing, or the sort of ways in which we're looking at informing the work that's being undertaken. So a very strong focus on Aboriginal and Torres Strait Islander communities, cultural safety, local artists, local stories. So we, in working with Queensland Health, one of the sort of elements that's been used, that we're using more and more in terms of this work, is also the First Nations design guidance that was created for Queensland Health, alongside some of the work that's been done in terms of Arts Queensland, in terms of cultural engagement. And so really seeing this as that it's often about sharing and learning on from multiple perspectives, because while we're working within health, there's also a body of work that is happening within the community and with artists about also best practice in these spaces and how to engage in health, how to really think in these participatory ways and contexts. And if they're interested in getting involved in arts and health work, what are some of the pathways around that? What are the ways that once we've started to open the door a little bit through some of the infrastructure projects, how are other ways that they can get involved?
I think one of the great outcomes of the Wide Bay project was also the development of a lot of information, formal information and training for artists who are going to intersect with the health sector. It's just in terms of preparing them for what a clinical environment might be like if they haven't experienced it before. It can be challenging. It can be busy. It can be noisy. And things happen in clinical environments. So Danny did an amazing job putting together a lot of resources for artists and practitioners before they were brought in to the healthcare environment. And that's now a body of resources that's going to be available more broadly, because we are in the process of creating a toolkit or a repository of resources that can be used, that will eventually be able to be accessed by anybody who needs them. So in terms of the work that we're doing within infrastructure, as Erica Rose said, the thing, and as Bonnie mentioned with the Dakaban project, the thing that's coming up most strongly and most overtly is the interest in local stories, in telling local stories. So we experienced that when we were doing consultancy work a few years ago, working on the Ipswich Mental Health Unit. The strong kind of directive that we were given on that was local artists only. And that was fine in Ipswich, because there are a lot of really talented creative people who live in that region. It's more of a challenge in other places, but there are solutions to that. There's the option of mentoring. There's the option of partnering with senior artists. And so we honour that need from all of the communities that we're working with, and that they, we're currently working on projects from Cooktown to Doomadgee to all down the eastern seaboard of Queensland to out west to Toowoomba and to the Gold Coast. We honour that need for their own stories to be told. It's coming through very strongly in the public surveying that we do, which has become a routine part of the establishment of the project, asking people to tell us what they want to see and what they want to experience when they're in hospital. So this is an example of one of the reports that was generated out of a public survey that was conducted around arts in health, specifically arts in health, for the new Bundaberg Hospital project. We were delighted with the degree of response. There's no lack of, response. We get responses from healthcare staff, but also from community, from people who have lived experience. There wasn't, in all of the surveys that we've done across many projects now, there wasn't a single statement around why are you wasting money on art. Not a single response. Basically, people just got immediately stuck in to telling us what they wanted. They wanted artwork. They wanted it to tell local stories. They wanted it to provide points of connection. They wanted it to represent the diversity of their communities. And they wanted to see themselves reflected in the artwork.
I think one of the things that we're really interested is they wanted to see it integrated throughout the hospital.
Yes.
And be accessible as well. So this is really interesting to get this feedback from the community to then be able to use it in all of the arts and health working groups across the state to I guess, reinforce the ideas that we're sharing, that it's also coming from local communities as well.
Yes. So part of the work that we're doing is apart from personally showing up and talking to the stakeholders in all of these communities and with all of these health services, which we do a lot of. We attend all of the working group meetings. We have helped develop all of the resources. We know that if we disappear, there's a risk. This is always a risk in arts and health, because so often the work that we do is built by champions and allies. And if those champions and allies depart the scene, then sometimes there's a vacuum that doesn't get filled. And so we're trying to mitigate against that by making sure that there are resources that can be used for years to come, and by also building capacity and building skills within health services in particular, and within Health Infrastructure Queensland as well. So one of the ways we're doing that is by producing these publications, an Arts in Health framework and an Arts in Health toolkit. For the Arts in Health framework, we have been inspired by the Arts in Health framework, which was published by the Australasian Health Infrastructure Alliance a few years ago, and which still is an extremely important and significant document, and carries with it, within health infrastructure, carries a certain weight within it, because the guidelines from AHIA are almost biblical in their importance when it comes to health infrastructure planning, and they're used for everything from deciding where sinks should go in a patient bedroom to what kind of models of care you should have within emergency departments and birth centres and mental health units and intensive care units. So being able to produce that Arts in Health framework under the auspices of AHIA was very important. Queensland is the kind of state that thinks it needs its own version of everything. So being able to then produce a bespoke Arts in Health framework for Queensland Health has been a step forward, because previously, while there were some people who were aware of the AHIA document, and we certainly tried to socialise it as deeply and as broadly as possible, it was too easy to dismiss, because it was about this thing called Arts in Health, which nobody really knew about, and it really depended on if a project director was interested in that, or if the health service insisted upon it. And it was too often the thing that got the red line through it in the budget in terms of health infrastructure planning, because in Queensland we no longer have a % for art scheme in the public realm. So we agreed to produce a bespoke framework for Queensland, and we've accompanied that with a toolkit. So the framework itself makes the case for Arts in Health, why this should be happening, and how to make it happen. Providing the evidence, centering First Nations principles in everything that we do, providing detailed instructions on how to set up from the beginning, at what stage of infrastructure planning to start having the conversations, who should be involved in those conversations, who should be leading them, how to make sure that co-design is a founding principle of all of those conversations. And then the toolkit is full of templates, templates around terms of reference for arts and health working groups, around curatorial strategies, around budgets, around how to write a didactic or an expanded label about an artwork in a hospital, and how to pitch it. So anything that we can think of that will make it less mysterious and less opaque and less scary for health planners and the stakeholders within the health system to actually make it happen and to apply it consistently. We have put in the Arts and Health Framework and the Arts and Health Toolkit, which are a couple of weeks away from publication online. It's actually been extremely useful doing the work and writing the framework and toolkit at the same time. We joke that we've been designing the plane while we fly it, but it's been much better to do it this way than it would have been if we wrote the framework at the beginning and then tried to impose it, because we have learned so much from our colleagues who participate in this work with us, both within HIQ and within the health services, so that the framework and the toolkit are deeply informed by all that we have learned from them and what the pressures are on them and what they need help with, and what the narrative is that they need in order to be doing the advocacy for the work.
And we can already see that even though they're not published publicly, that they're having an impact, because we're being contacted by other health infrastructure projects in Queensland at earlier and earlier stages. So instead of contacting at the end, oh, we need some help with the art, some of the projects are starting to reach out now. And it's also been useful in terms of people coming to some of the first meetings with more information, so we can move forward together on the same page earlier. So I think already we're seeing those elements. I might just talk about one of the things that's an outcome of this arts and health integration that is a parallel project that has emerged from this work together. So while we were engaging in the sort of planning for the different hospitals, one of the things that came up through a few different channels was this idea of the presence of Queensland First Nations artists in the furnitures, fixtures, and design space. So this happened through a whole series of channels, first communicating with Lynne and Bonnie through the furnitures, fixtures, and equipment team from Queensland Health, asking, would it be possible to have Queensland artists design items, Queensland Aboriginal and Torres Strait Islander artists design items for this space? And we started to do a bunch of investigation. And at the moment, there is a gap in the interior design and the clinical spaces in terms of what is available for use. So Arts Queensland has undertaken a parallel initiative that is commissioning the design of a First Nations design suite. We're partnering with the Aboriginal and Torres Strait Islander led design agency Blacklash to develop a pilot design suite which can be used in these health infrastructure projects. So initially focusing on some of the sort of key big hospitals that are being built, with the real desire to tell local stories from local artists and to sort of embed this idea of arts and health in other ways. So it will be 12 designs from 6 artists. And we're really looking at how this not only would help in sort of support this development of opportunities for artists in the health infrastructure space, but As many of you know, the Olympics are coming to Queensland in 2032. So how do we build some of those ramps or those pathways for people to be participating in meaningful ways connected to manufacturing, working with suppliers, working with interior designers? Because we were in some of these meetings and we would see that some of the designs that were suggested by the interior design team were beautiful designs for, say, fabric, for chairs, but they were from artists from WA or from New South Wales. Beautiful artwork, but this desire of how deeply can we embed those Queensland stories. So very excited, and we'll provide updates as that proceeds.
Okay, so we have about 10 minutes left, and we want to make sure that we leave enough time for some conversation and to respond to any comments or questions that you have. We had an interesting time doing the matrix earlier, Claire, and kind of trying to figure out, you know, how we'd made things work for us. It's kind of it's one of those situations where you take steps forward, but you stumble as well along the way. But without doubt, I think the fact that in Queensland at the moment, we have momentum, we have expertise, we're expanding the expertise, we're expanding the awareness, we're creating opportunities for artists, where we're building their capacity in terms of operating in an arts in health environment. As we said earlier, it's about partnerships, it's about finding allies, and leveraging resources. So, for instance, many of the cultural organisations that we work with, they all have outreach and engagement obligations. And so they're willing to talk about how they intersect with the health sector in order to fulfil those mandated obligations of engagement and outreach. Finding champions within your own organisation. Sometimes those champions need to be decision makers. Sometimes they can just be people who can spread the word. What we find is with every project we do, no matter how big or how small, we build the relationships and we kind of add to the posse of supporters and the people who are willing to talk to their colleagues around how important the work is that we're doing and why they should be doing it too. We get involved in strategic conversations at a government level and at an organisational level and make whatever contributions we can to those conversations. We never say no to that opportunity. We make sure that the work that we're doing is based in research. So, because in health, people like evidence. And we are hoping that the evidence base in terms of Australian experiences will continue to build, but there's abundant international evidence that supports the work that we do. We work across multidisciplinary teams. So, for instance, on our Arts in Health Advisory Committee, we have internal and external stakeholders, and those internal stakeholders are from all across the hospital, from our facilities managers to our communications team to our executive leadership. The external members of the committee are from all sectors of the arts and academia. And we continue to find ways to evaluate and share the good news about the evaluation, as Arts Queensland has done profoundly with the Wide Bay project, and invariably we are finding that the response is extremely enthusiastic, and that the work leads to more work. And what that means is that leads to more opportunities. Erica Rose, is there anything you want to add at this point?
Yeah, I just want to say, just before we open up to questions, that in many ways, this is a wonderful sort of full circle on the spiral of learning. and want to just acknowledge Claire in terms of all the work that you've done to create a space for us to come together in this room, but also online. And that it's wonderful to be able to have this sharing of knowledge. And really, I think that we can see and feel the evidence of the work that's being done, but it's also nice to be able to sit and listen and to continue to learn and this space. So just wanted to acknowledge that and your leadership for this. But wanted to open the floor to questions.
Oh, Catherine, I just wanted to thank you for an absolutely inspiring presentation. It was just, your work is amazing. And to see this beautiful marriage of art in the health. And I think that short of Deck the Wards and the absolute joy on the patients with all the creative things they were doing. So thank you very much.
Hi, my name's Shan, and I just work up the road at RPA Hospital. We run a wellbeing program for staff. First of all, I want to say this toolkit sounds amazing. Very, very excited for it. One thing in particular I'd love to get some advice from you guys on is, for us, one of the most important things which you've touched on is the surveying and collecting of data. And a lot of our success of our programs are reliant on that collection. So very keen on your advice. A barrier that we do tend to have when surveying, because every initiative that we run, we collect survey, is survey fatigue. And it sounds like you've got some successful answers from your survey. And I'm just wondering whether it will be in the toolkit, how you get over the barriers of the survey fatigue and low numbers come in as a result. It's always sort of a challenge that we always face.
Yes, a template for a survey will be in the toolkit.
Brilliant.
The key to successful surveying is timing. And in the healthcare system especially, survey fatigue is definitely a factor. It's a factor with staff, yes, because they're always being asked to their opinion on things. But also for the community, especially if there's a big infrastructure project or something major happening in the community, and they're continually being asked to participate, to offer their time, to kind of offer their experience. So we've relied on our colleagues who are on the ground to tell us when it's time to do the survey. And that's been different for each project. We've had to let, in some cases, the project mature a bit. We've had to make sure that there's no confusion around what we're asking. And we've also had to make sure that people receive it as a good news story, that it's something enjoyable that they can participate in, that it's not, asking them to give more than they can give, but that it's a way of them being able to eventually have a health facility in their community that they can walk into and see something that represents the advice that they've given us. And I think what's helped with that has been the consistency of that advice has been very easy to implement. So,
yeah, that's brilliant.
Yeah.
Thank you.
I might just add to that in some cases, different communities took the survey questions, but then did it with a hard paper format or in a kind of a focus group context or a more sort of dialogical way. So, but we're using the outline of the sort of key questions so that we could pull together all of that information. So things that are engaged in lots of sort of community participatory processes, but really being guided by each particular context in terms of what was the right way to go for that timing, the format, and the way of engaging with community. I might just, oh yeah, is it all right?
To just add that Danny, who led the survey for the Wide Bay, the new Bundaberg Hospital, she said that she also gamified and incentivized participation in the survey. So free hot donuts for the departments with the most responses, email comms showing which department were in the lead, and igniting some competitive fun.
So it looks like we're sort of right at lunchtime, but maybe if there's another question, either online or, oh, question. Oh, yes. Hi.
Hi, my name's Carly. This sort of runs in line with what was said earlier about survey fatigue. But I was wondering, how do you step away from, collating data and actually enacting like tangible change within systems, especially systems as large as, Queensland Health, for example?
Did everyone, so the idea of how to enact, move away from the data that's collected to actually how do you enact systemic change? So.
That's a really good question. A government department like a health department is a very complex beast, and the health services in Queensland are all huge. I think it goes back to talking about those kind of key things for development and implementation, making sure that you have the allies and the champions, you have the data to show them that they'll be persuaded by, but that kind of the goodwill that you build from that runs out really quickly. So you have to keep up a fresh supply. And I know that is a pressure. That is a pressure. I think that we are experiencing systems change in Queensland right now in this space, given that we're centralising the arts and health work across government. So it's really been about that, being able to collaborate and partner. This partnership was set up at Director General to Director General level. So that's where it had to happen. And so we were kind of pushing the ball uphill until someone at the top caught it. And we just had to be prepared all the time with the evidence and the material to sustain the argument. So there's no easy way to do that. It's about finding the ways in and finding the people, and then being noisy.
And persistent. I think it's a long game in terms of the long journey, the long road, and that it's about all of those different stakeholders. So with it in these kinds of projects, it's not just the health service, but it's also the builders or the people who are working in construction. So sometimes the advocates come from the places you might not imagine. So it's always really fantastic when we go into a meeting and somebody from the building team says, oh, we figured out a cost savings here, so now we can spend more money on art and look at this great opportunity. So then it's about, I think the idea of how do you capture people's own passion and their connection, whether it's the fact that they're going to be using the health service themselves, or the ways in which they may have lived experience, and then bringing everybody along on that journey with you and having that stamina over time. So
we try and make sure, we have a bit of a mantra, and that is we try and make sure that the meetings that we're in with the people who are extremely busy, who are preoccupied with 1,000 different decisions and spreadsheets, and that the meetings that we're in with them are the most enjoyable meetings that they have. So we tell them at the outset, these are the meetings that you're going to have fun in these meetings. This is going to be the fun part. And we were told again the other day that this is the one meeting I want to come to, because and we know why, right? Because when you immerse yourself in this, and when you start seeing the promise of it, and you start listening to the stories, and the kind of veil of suspicion falls away about accessibility and who it's for, then that's where real engagement happens. And when you're engaging with the right people, then that's when you get progress.
I think we'll probably wrap up there, but we are very much interested in ongoing dialogue and conversation. So please reach out, get in touch with all of us, one of us, and would love to hear about the work that you're doing, but also other questions that might come up, because we are building on our own knowledge, but continuing to learn and grow as we go as well.
Thanks, everybody.
Thank you. Thank you.